Tonight, WRTV is exploring health disparities that largely affect the health of Black communities.
Our Stephanie Wade talks with public health professionals examining the systemic issues that are now being highlighted during the COVID-19 pandemic.
Last year in 2020,
we saw the world come together and stand in solidarity and say that Black lives matter.
And as experts say, the coronavirus pandemic has unveiled.
But Black Lives Matter just doesn't have to be as it pertains to gun violence or racial violence.
But mattering in all aspects like health and quality of life. According to the CDC, when compared to their white counterparts, African Americans are 1.5 times more likely to contract COVID-19, nearly 4 times as likely to be hospitalized as a result, and almost 3 times more likely to die from it.
What does it mean when you want to have access to primary care physicians or even to get to them and you can't?
Diversity and public health experts are discussing institutional and systemic inequities they say have put the Black community at higher risk of COVID-19.
There's not as much space to actually be 6 feet apart. A lot of these people are living in apartment buildings.
Access to health providers and insurance coverage.
Dr. Antonio Williams highlighting the increased risk of exposure many in the Black community face with jobs as frontline workers, either in grocery stores, restaurants, or public transit.
They're more at risk because they're exposed more, but you also have those underlying chronic conditions and these non-communicable diseases that we have in the African American community, as Rory said, asthma and hypertension and high cholesterol and diabetes.
Recognizing that we all don't start at the same place. And so we've got to acknowledge that, and we've got to make adjustments for those imbalances that exist.
They suggest we all take part in addressing inequity and help fill the gap when it comes to health disparities and improving quality of life for our Black community.
A lot of African Americans are in communities that lack green space, are not walkable communities, don't have the proper lighting, don't have parks and recreation. And we all know that they're also in food deserts. So I challenge our professionals to educate policymakers and key stakeholders in those communities, maybe pastors and others, principals and all, to start to address the reasons why people are physically inactive in these areas.
Work with places of worship, to make sure that we can, you come here to praise or to worship, but also maybe on a Saturday, maybe we can do some demonstrations of physical activity so that we can have a broader reach and meet the community where they are.
Stephanie Wade, WRTV.